Alright, so still hammering on the different disorders that could actually affect children. We're talking about what is known as what? The autism spectrum. So when they say something is a spectrum, it's like the thing is big, alright, contains a lot of things in it, you know. So autism spectrum disorder, you know, it's just a complex what? Neurodevelopmental condition. So it will affect how a person is communicating, it will affect how a person is thinking, you know, and how that person interacts socially, you know. Also how the person is able to process sensory information and all, you know. So the term spectrum reflects what? The wide variation in symptoms, all right, the skills, level of disability. You are not saying, you know, it's one thing. Different people who have the same disease manifesting in different ways, you know. So that's why that's how the, you know, the concept of spectrum actually comes there. So just like it's actually a wide, you know, coverage, it's not caused by a single thing, but it's believed to be a mix of what? The genetic and also the environmental experiences of the individual, you know. So for the genetic and inherited traits, you could have this issue, and it's also depending on your age, the age of your parents. So if you have older parents, even men that are older, their sperm is weaker and all, you know, prenatal exposure, maybe you're exposed to some medicines that actually cause you some issues, you know, low birth weight, you know, premature birth. So family history of autism and related conditions. So importantly, vaccines do not cause autisms, all right, as confirmed by what? Extensive research. So core symptoms is you know, social communication challenges, you know. So the person with these autisms, we have limited eye contact or limited facial expressions. They will have difficulties what? Understanding things, all right, delayed speech or language development. They have trouble with what? Back and forth conversations, all right. Then they just want to be alone. Restricted and repetitive behaviors is repetitive movement like hand flapping. This is, you know, hand flapping, you know. Then intense focus on specific interest, resistance to change in routine, sensory what? Sensitivities, you know, unusual attachment to some objects and all of that. So diagnosis is what? You could see this what? The spectrum. So the spectrum is involving different issues. Diagnosis is just developmental screenings, you know, behavioral evaluation by specialists, genetic testing just rule out other related conditions, speech, occupational, psychological assessment. All right. So treatment and support is this: behavioral therapy, speech and occupational therapy, social skills training, educational support, medications for co-occurring issues like anxieties and attention deficit, what? Hyperactivity disorder. So some individuals may benefit from alternative therapies, but this should be carefully evaluated for safety and effectiveness.